Good morning, everyone, and welcome to Mr. Selfcare Live, your Sunday morning destination for real, relatable, and reliable conversations on health and wellness. It is exactly 7:53 a.m. and I'm your host, Mr. Selfcare, as usual. And today's episode is one that many of you have been asking us to talk about. Yes, you asked, and we've answered. We are going to unmask, we are going to discuss, we are going to digest and break down vaginal candida. Vaginal candida, or yeast infection, as many of us call it, affects millions of women around the world today. Surprisingly, many of these still are suffering from stigma, confusion, and misinformation. Majority of the women that are suffering from vaginal candida actually fear to talk about it. To some of them actually believe it's a normal way of life to have yeast infections or vaginal candida. And today we are here to break the silence and shed some light on what is normal and what is not, and actually what we can do to make sure we still prevent or control these yeast infections or vaginal candida. Today we are honored to be joined by a panel of experts. Ms. Nalvega Flavia, a clinical public health specialist. Mr. Nwagira Gerard, a senior human nutritionist. And together we are going to explore the causes, symptoms, prevention, and the treatment of vaginal candida from the medical, nutrition, laboratory, and public health angles. So, just like me, grab your cup of coffee or tea. Remember to say hello to us in the chat section, and don't be shy to join the conversation in the comment section. Drop your question as it will be answered by the experts. And for those that are lucky, some of your comments may be aired live for everyone to see. So let's dive in. And in a simple way, let me have my panelists introduce themselves, and then we shall pick it from there. Mr. Gerard, introduce yourself to our viewers and who you are, what you do, and what we should expect from you today.
All right. Thank you very much. Good morning, everyone. Live from Uganda. My name is Jared Niwajira, a public health nutritionist. I specialize in a number of fields within public health, including nutrition, doing a wide array of interventions within communities, and also supporting the clinical bit of it where possible. And I'm glad to join this channel today to talk about vaginal candida infections and how nutrition fits into all this, how the care can actually be supported more to ensure that a client receives wholesome information and wholesome care to ensure that vaginal candida is treated and managed successfully. I'll be sharing a wide range of information on how we can incorporate nutrition into our care for vaginal candida. And as the questions will be coming in, as the conversation will be flowing, I'll be sharing more. Thank you very much.
Okay. Okay, thank you so much. Madam Flavia, can you introduce yourself to our viewers today?
Yes. Good morning, our viewers today, or good evening, good afternoon from wherever you're watching from. My name is Naluvega Flavia, and I'm a public health specialist with some clinical background as well. And I'm glad to be here this morning to share with you. Thank you.
Okay. We are honored today to have these two knowledgeable people. Later, we are going to be joined by a lab expert, Mr. Nkusa Richard, who is still having connection issues, but should be with us shortly. And I'm glad we are tackling this issue of vaginal candida, because it's one of the things that are really disturbing ladies world over and in so many places. To start off with, Madam Flavia, what is exactly vaginal candida, and how is it different from other type of yeast infections or bacteria imbalances?
Yes, thank you. Vaginal candidiasis is a yeast infection. It's an inflammation of the vagina. It's a vaginitis, to say, really. And it's caused by a yeast infection, like we have said, Candida albicans. And unfortunately, this particular causative agent is responsible for more than 50% of Candida infections. We are talking about it as being a little bit different because research says that it affects about 75% of women, and that's a very big percentage. 75% of women are expected to get it at least once in their lifetime. And yeah, we see there are many myths around it. Thankfully, we have this program this morning to dispel some of those. So yes, I think that's what I would call it in a nutshell. It's a vaginitis. It's caused by Candida albicans, and it's affecting 75% of women at least once in their lifetime.
Again, on the same, Madam Flavia, why do so many women experience vaginal infections or vaginal candida of late compared to what it was a few years back? Yes, Flavia. Did you hear that?
Yes, I did. Thank you. Um, to start us off, I'd like us to know that these organisms are actually naturally present in the body. They are naturally present in the vagina. For some women, they are present there and they have no symptoms, about 20 to 30%. In some, they can get some few symptoms here and there, but they are cleared naturally. So the science here is they are supposed to be present at a certain balance. They should not exceed certain levels. But in case they exceed a certain level, then that is when they will progress into an infection. But otherwise, they are supposed to be there as normal flora, beneficial to the body. Unfortunately, there are very many developments these days. There are very many ways women are cleaning themselves and disrupting this balance in the body, and then bringing up bringing up the infection. They are bringing imbalance, the different cleaning things, the different scents people are putting in their vagina that are distorting this natural balance, that are bringing this infection, that are causing the rise of this infection. And unfortunately, in some, it becomes recurrent.
Yes. Madam Flavia, can you throw more light about the imbalance? You said unfortunately women today using a lot of cleaning detergents in the vaginal canal. And that is true because today we're having a lot of vaginal washes, herbal and non-herbal. Can you talk about how these actually are bringing about more prevalence of candida cases? can you break it for a lay person to understand? You can actually also you put this in Luganda for everyone to properly understand.
Okay, so under normal circumstances, these organisms are supposed to be there. They somehow help stimulate the immune system. They train it gradually to be able to recognize and regulate these fungal organisms, the natural immune system of a woman. The presence of these organisms help it to regulate these fungal organisms. They bring about that balance that we have talked about. And also additionally, they compete with some other harmful bacteria that would be harmful in the vagina under normal circumstances. The beauty of the female reproductive system, the vagina especially, is that God created it to naturally clean itself. The bacteria there manage the pH that is there. So there are some things that are produced, some normal substances or chemicals the body is producing that keep these microbes in check, microbes that would otherwise be harmful. So the vagina will produce its own discharge that will flush out any maybe dead cells or any bacteria or any debris. And this is natural. That is the natural process that is supposed to be there. Unfortunately, with the different cleaning agents, people are using scented soaps, people are using herbal medicines like you've mentioned. There are all sorts of products that are on the market today. Maybe they are telling them maybe these are going to help you smell better. So introduction of all these is disrupting the natural pH. You're disrupting the organisms that are supposed to be there to keep that place functioning as it was naturally supposed to be. You're disrupting that pH because there's supposed to be a certain pH that is expected there to maintain that balance as well. So introduction of all these external things is disrupting the normal flora that is there. Let's say it's like clearing the things that would help to keep that system functioning. While we are thinking that we are cleaning or improving, we are actually distorting and changing of the normal conditions of this environment is what is allowing the unwanted bacteria to grow more than they should grow and therefore result into an infection. It is causing the changes, like we mentioned, the pH, the changes in the normal functioning conditions, and hence promoting growth of the bacteria that are bringing this infection.
Okay. Mr. Gerard, you're a nutritionist. You're going to come in here. What's your take on vaginal candida and how it comes about from the nutritional part of it? Because now Madame Flavia is talking about microorganisms are harmful and the imbalances. Can you throw more light on how candida actually comes about?
All right. Well, with vaginal candida, it is, as she's mentioned, it comes from the Candida albicans. These are usually naturally occurring within the vaginal cavity, but then there happens to be triggers that enhance its growth. They optimize its growth, and you find that it becomes an infection. These are already existing within the vagina, but then there are triggers. They could be environmental. And I, as a nutritionist, I usually look at these challenges not just from the medical part, but also from how our everyday choices make up to lead to certain infections like the candida we're talking about today. So, and usually some of the foods we also eat, she has also mentioned the number of, as we kept mentioning, the different uses, the herbal thing, the herbal medicine, non-herbal. You find that someone is using bleaching to ensure that they fight off this infection. but then they're usually making it worse because even these substances they're using are actually triggering it to grow more and more.
Okay. Madam Flavia, again, back to you before I come to Mr. Nkusa Richard. What are some of mutugambye nti naturally Katonda yakola obukyala bw'omukyala nga bulina balance in mu buwuka obulungi n'obyobeeramu. Mutugambye nti oluusi ekireeta imbalance eno bintu bingi, nti abakyala abamu bwe baba banaaba ne bakusa sabbuuni alimu obuwoowo balimu chemicals zitta obuwuka obulina okubakuuma wansi ebyo, ne baleka system zaabwe nga ziri open oba tezikuumiddwa. Madam Flavia, how is Candida transmitted from one person to another?
Yes, thank you for that question. When we look at Candida transmission, first of all, we need to understand that it is first of all endogenous. By endogenous, we are meaning, like we said, fengafe, obeera oyina obuwuka obwo naye nga buli mu correct context, buli mu correct balance. Kakati ekintu kyonna kyonna ekitataaganya balance eyo kye kireeta obuzibu. Nti we are not going to say that it is transmissible all the time from one person to another. Emirundi egisinga kibeera kiri ku ggwe muntu kinnoomu, nti waliwo ekintu mu mubiri gwo ekibeera kikyankalanyiza balance eyo. Si buli muntu lw'abeera ne Candida nti abeera amujje ku muntu oba wantu. Wabeerawo ekintu ekikyankalanyiza balance eyo mu mubiri gw'omuntu okumuleetera okubeera nga nti these normal flora have turned into an infection against the body where they are supposed to survive normally. So before I can talk about transmission, I think I would like us to understand some of the risk factors that make this balance change, the risk factors that make these organisms that are supposed to be at a certain level, that cause an overgrowth, I should say. Nti waliwo abantu nga bakozesa nnyo antibiotics. Unfortunately, this is one of the predisposing factors. Nti overusing antibiotics is going to kill the competitive bacteria in the vagina naturally. Wabeerayo bacteria ezicompetinga nga zirina okubeera nga zeecontrollinga, zeemanaginga zo nga zo to be at a certain level, emu ereme kusukka wa weeyina koma. So if you're overtaking antibiotics, these competitive bacteria are going to die, and then the Candida albicans zigenda ku thriving, and then we shall have an outgrowth that will lead to the infection. So that is one of the things. Then also in some cases, for some people that have immune suppression, maybe people that have long stayed in hospital, people with HIV, people on chemotherapy, cancers, some of those conditions that suppress the immune system are going to cause an overgrowth rather, of those infections, rather of those organisms, and then we shall have an infection. Then people in diabetes are also at a higher risk than those that are not. Then we also have cases where estrogen levels are high. Estrogen is a normal hormone in the women, but there are cases when it is high. For example, for people that are on maybe oral contraception, or people that are pregnant. When this hormone is high, it will also bring certain issues down there. There will be it will be predisposed. It's a risk factor. So those people are at a higher risk as well. Then also the hygiene. Twayogeddeko ku hygiene ng'otandika nti some of the environments of these body parts, if they are not kept as they should, then we are going to have an overgrowth. So if there's maybe warm and moist environments, they tend to thrive there. So if that is not looked at, then there is going to be that infection coming up. People that are using catheters, again, we mentioned those that are in hospital, then the poor vaginal hygiene, we talked about the soaps. So yes, that is one of the ways that we would look at it. If we are saying that it is being from one person to another, if someone is to contract that from somewhere else or from someone else, again, it would be in cases where they are at risk themselves. Otherwise, it is not commonly transferred from one person to another. That is what I'd like us to know, that in as much as it is, there are very few chances, and even then, it is when the person that is getting it or contracting it is compromised in a way themselves. But we have also seen some cases where it can be transmitted amongst partners. Again, the risk factor issue remains a constant. If that person is compromised in a way, yes. So we can have cases where it is transmitted from one partner to another. In the males, it will present as balanitis, and then the female will be complaining of the vaginal candidiasis, like you mentioned.
So Musawo Flavia is saying that abachala abali eyo nti Candida is mainly the following are mainly responsible for transmission. Number one, increased use of antibiotics. Abachala mumira nnyo antibiotics for no reason. Antibiotic abuse. Era kinyonyodde bulungi nti antibiotic yatta obuwuka obulungi obulina okuba nga bringing a balance mu kubuwuka obuleeta Candida. Nayogera ku buyonjo. Abakyala abamu oluusi obuyonjo bukusukkako. Nayogera ku immunosuppression, abantu nga obulamu bwabwe buli compromise, abantu abali ku ddaga, endwadde ez'enjawulo ez'amaanyi, zi TB, zi siriimu n'endwadde endala. Also nayogera ku bintu sexual transmitted. Madam Flavia, before you go, next I'll be going to Mr. Nkusa, I think, to take us through. Ogambye nti ku transmission obulwadde obwo okuva ku muntu omu nti oluusi tebuli transferable. Kyenjagala okubuuza, can a woman get vaginal candida nga teyeegasse na muntu mulala? Because buli nnaku tulaba abantu nga batusomesa ku dirty bathrooms nga bagamba dirty bathrooms, dirty toilets. Can we talk about that, public places? Is that another source where we can get these yeast cells or candida from? And then also talk about women or young girls sharing underwears, because I was part of a research in some university, and a group of girls in a dormitory actually were free, telling us, for us, we just put our panties on one peg, you put on whatever you want. And I've also had couples abagamba nti their children actually got candida because they were sharing a sponge, bathing sponge, ebyangwe, or basins with their mothers who could have had candida. Is this true? Can you talk about those?
There's a lot of contention around candida being acquired from bathrooms, from different people. But like I mentioned earlier, under normal circumstances, candida should not be contagious. By contagious, I mean it should not be transmissible from one person to another. And under normal circumstances, it should not be thought of as a sexually transmitted infection because of the risk factors that I mentioned, and that it is normal flora in our bodies. It's mostly an opportunistic infection. That's how we would like to look at it. It's an opportunistic infection. And if it finds you in the category of the risk factors that we have looked at, then it will thrive. So yes, in as much as the bathroom may not be clean, or someone's mother may have it, or someone may have a knicker they are using that is that, and for them they are unwell, and all those factors that are there, the person that, let me call them a recipient for lack of a better word, the person that is contracting, in quotes, contracting it from one person to another, there are factors in them that are making it possible for them to contract it.
Okay.
Yes.
There is, I'm sorry, there is something again. I've had so many cases nga couple zigamba nti omwami yafuna oral sex because maybe he put his tongue somewhere mu kifo ekirowoozebwa the V part of vaginal canal of his wife, nafuna oral candida. But you're saying in normal circumstances it should not be transferable. I've also had cases where couples zigenze for treatment, abasawo ne babagamba tebeegatta until okay, Gerard Agami in the central city, until nga the reason they are giving is because omukyala ina candida, so tayagala mumusiiga mwami. Let me invite other panelists. Mr. Nkusa.
Yes.
Mr. You're a laboratory expert.
Okay.
How have you gone with this issue called Candida? Before I come back to Flavia to talk about what I've just explained, let me give her time to digest it. In lab, how far have you gone with diagnosis of vaginal candida? Because abamu batugamba nti up to now vaginal candida cannot be mu lab tetusobola mucheckinga. Is this true?
It is actually not true. We can actually diagnose Candida in the laboratory, and we can do majorly 3 types of tests. That is microscopy, through a wet preparation. We can do culture and sensitivity. We can do PCR. We can do PCR. Those are majorly those 3 types. And in a wet preparation, we can get a suitable sample from the swab in the V region where the infection has manifested. We can use a swab and collect a very suitable sample, then make a wet preparation, add some potassium hydroxide, and then we are able to examine it through the microscope, where we are able to observe yeast cells. And the moment you observe yeast cells, shall always confirm presence of Candida species, or maybe Candida albicans. Then there can be also a biochemical tests. For example, if we collected that urine, the urine sample as well, we are able to do a biochemical test using those urine strips, where you will realize that the pH has deviated from the normal, which is near acidic, to alkalinity. So you will also be able to observe that there is an increased pH of the urine. And then we can do the culture and sensitivity, whereby those albicans, the yeast cells can be cultured on blood blood agar, and then they will cause growth, and the growth can be done a sensitivity test, which is able to identify the most suitable antibiotics that can clear them from our body circulation. Thirdly, we can do a PCR, whereby some specific antigens are able to be done a polymerase and multiplied, and then we are able to code them and identify them as particular antigens. So basically, that's how we usually diagnose Candida in the lab.
Mr. Nkusa, how accurate are these laboratory tests in confirming Candida? Because abakyala bangi abali eyo, actually abasawo bangi era leero nfulidde information impya nti Candida tusobola omucheckinga mu lab. Emirundi egisinga abakyala tubadde tubagamba mu malwaliro nti Candida tumulabira ku bubonero bwokka. Madam Flavia bwagenda okuba nga atubuulira gye bujja Katonda awo. How accurate are these lab investigation in confirming Candida?
The gold standard for Candida is culture, because we have that blood agar, we grow it over for 24 hours, and then there will be growth. So the moment you put a swab sample on the agar, the moment the growth comes up, that means the yeasts have done what? Have been able to grow up. That means that confirms the presence of the yeast. And in so doing, it will be a confirmation that there is an infection.
Okay. Mr. Nkusa again asking this. Are there different types of or different species of Candida that affect the vagina, and they respond differently to treatment?
Yeah, there are a number of them, and it is always the culture and sensitivity test that is able to do what? That is able to show the effectiveness of the different antibiotics that are able to work on them. Yes, we have a big number of them.
Okay. Lastly, before I go to back to Flavia and then later to Gerard, Mr. Nkusa, is there any concern about antifungal resistance? Just like we have bacterial resistance in vaginal candida cases, especially with over-the-counter treatments. Is there a chance that some people can reach a stage when these antifungal drugs can no longer work on them?
Of course, wherever there is a misuse of drugs, for example, people do not complete the dose, or people are always getting exposed and in issues of reduced immunity. So there will always be that issue of resistance. The issue of resistance shall always arise whenever there is non-compliance with the treatment. For example, people getting weaker kind of ineffective kind of antifungals. You know, they are always the stronger antifungals and then the weaker ones. The more you treat your body with cheaper and weaker antifungals, the more are the chances of resistance. So that means these infections should always be treated and managed by experts, well-trained health professionals. The more you get access, medical access to poorly trained medical cadres, the more are chances of raising such resistances. Thank you.
Okay. Flavia, over to you before I go to Gerard. Flavia, are we there?
Yes, I am here.
Okay, what are some of the most common symptoms of vaginal candida infections? What should omukyala bonero kibwana alaba n'agamba nti ndabika nina candida, oba neetaaga okujjanjabwa? Yes. Can you hear me?
Yes, yes, I can hear you. Thank you. Please allow me to first clarify a little on what you mentioned earlier.
Okay.
Yes, as I mentioned, that Candida is largely an opportunistic infection. We cannot dispute the fact that it can be transmitted from one person to another, like the ways that you mentioned, but those are the rare cases. Those are the rare cases. Yes, it can happen, but those are the rare cases. And even then, I'd like to emphasize that there's usually a predisposing factor in the person that is acquiring from another. That's what I wanted to clarify. We can't dispute it. It's possible, but there are fewer cases. Then going on to the signs and symptoms, usually people will complain of a burning sensation in that area. There is burning. Some of them will have the itching. Then there'll be pain. Some people will complain of pain when they are passing urine, or pain when they are having intercourse. Then there's a characteristic vaginal discharge. I think this is what is most common to most people. When you mentioned that sometimes signs and symptoms are what help to make the diagnosis for this, there's a characteristic vaginal discharge for Candida, usually white or off-white, like spoiled milk. That's what most people characterize it as, like spoiled milk. So it's some of these signs and symptoms that people will present complaining with. Then some of them may have some small fissures, maybe cracks or lesions in their vulva, that area, the external genitalia of the woman. Some people will have those small cracks as well. Yes, those are some of the signs and symptoms to look out for.
Flavia, how can someone differentiate these signs from other bacterial issues like STIs? Basically, because I think many women abakazi abasinga confusing fungal candida over yeast infection in STIs, over sexually transmitted infections, over other reproductive infections. What are some ways we can differentiate them?
Like Mr. Nkusa was mentioning, sometimes in the lab we will have different things that are seen. The characteristic discharge that I mentioned, many times for other vaginal infections, for other causes of vaginitis that are not this yeast infection, the people will come presenting with a certain foul smelling discharge. The discharge is a bit different from the one that we are seeing in Candida. How it looks, its color, its smell, all these will be different. In the one in Candida will be different as well. Also, this burning sensation and the redness, they may not necessarily be present in a bacterial vaginitis. But this one that is specific for Candida, that is where we are going to see some of these more blown out, the burning especially, then those fissures. And then in candidiasis, the external genitalia, that's where most of these symptoms are showing up. In the bacterial vaginitis, many of the symptoms are going to be in the internal genitalia, really. But I'll allow the lab perspective to probably give us some insight on that as well.
Again, Madam Flavia, in a clinical setting, how do we normally diagnose yeast infection? Is it something that we normally refer to lab for checking, or how do you come to conclusions in the clinical setting?
In the clinical setting, usually diagnosis is made on history taking, on the physical exam, mostly. The history taking, the physical exam, what the patient will come complaining of. And like I mentioned, that discharge is specific, it's characteristic. You can't miss it. If someone complains of a discharge that is like spoiled milk, you will know this has to be a candida. It's unlike the yellow or foul smelling, it's different. So mostly, like you had said that you are not aware about the lab idea, it is mostly signs and symptoms on clinical exam. Usually people are sent to the lab when it is recurring, and we want to specify which particular organism is actually responsible for this one to make sure that they get a targeted antibiotic. But it's mostly the signs and symptoms and the history that client will give you.
Again, I want to thank people that partner with us to make sure this program is possible every Sunday. One of them is LifeX Africa. This is a company that abalina obukugu mu byendia in nutrition issues, and in case you need bw'oba ng'oli eyo nga olina obuzibu mu byokulya oba you need nutritional advice, abakyala abamu mwazaala abaana bakogga bukozi temumanyi kyakuzaako, LifeX Africa ejja kuba nga ekuyamba. Ne bannaffe aba Edisa Foundation, nga this is a charitable organization ekiri Kayunga Mukono, who make sure that this program happens every Sunday morning. Again, I want to thank all the friends in the comment section that are asking questions. All those questions are going to be responded to. Keep them coming. And again, thank you so much for being here with us. Flavia, before I call in Gerard to come and take us through the nutritional aspect of it, because of late, we want to appreciate the importance of the nutritionist as a department. That's why from last Sunday onwards, for every topic that we are going to be discovering, we are going to have a nutritionist on the panel to help us understand disease prevention. Because for many of us, endwadde tubali tuzirabiramu aspect of kujjanjaba. But now the new science is saying we can actually use food to prevent some diseases, but also to promote general health such that our bodies are strong. Flavia, before I call in Gerard, when does a yeast infection become chronic? Kubanga abakyala bangi afuna candida, nabeera ne candida year in, year out, candida n'afuuka candida. There are women have heard talk about candida for like 10 years. Nga tawona. When do we set out now that someone has chronic candidiasis? And now, how should this be approached medically?
Usually, if someone is having 4 or more episodes in a year, we would say they are having recurrent infections of candidiasis. And sometimes this may be due to incomplete treatment. Some people, actually, this is not for candida alone. Many people, when they are started on treatment and the symptoms disappear, they stop the medication. Yet they still need to complete it in order to clear the infection completely out of their system. But some of the recurrent cases that we are seeing is that people are not completing their treatment dosages, or if they are not getting effective treatment as they should. Some people are probably having mild treatments being given for severe cases of their infections. And then there are some strains that develop resistance to the common antifungals. There are some common antifungals that are given. I'm not going into the details, but some strains are developing resistance to these antifungals, and then people will end up getting all these recurrent episodes. Then we are having cases where, like I mentioned, diabetes being one of the risk factors, some of these uncontrolled high blood sugars will continue feeding these yeast infections and giving them just the right environment to thrive. So the person will continue coming back to the health facility to complain of an infection. Then the antibiotics that we talked about, many people are given broad spectrum antibiotics. Now, antimicrobial resistance is of the point that we have a culture and sensitivity done, and then we target a particular antibiotic to give for a particular microorganisms. But many people are going to healthcare facilities and they are being given broad spectrum antibiotics just to capture everything, in the hope that whichever microorganism it is, it will be swallowed up in this broad spectrum. Unfortunately, the natural guards are being killed, bringing the imbalance that we talked about. So it's discouraged to have this given without the culture and sensitivity guidance. Then we talked about the high estrogen. That's why some pregnant women will present more and more with recurrent cases. Then the people on birth control pills as well. Again, we mentioned the high estrogen. So yes, the recurrences will be common in these as well. The other risk factors still play the same part. The ones that we talked about, the vaginal douching, the compromised immune system, all these other things will also come in and play a part for the recurrent infections that we are seeing. So how we would handle that, we are sending people to the lab to do the culture and sensitivity that was mentioned, such that we identify what organism it is and what specific antibiotic is it going to be sensitive to for this infection to be completely cleared out of the system. Thank you.
Lastly, Flavia, before I go to the nutritionist, can you throw more light about Candida in pregnant women? Candida in this now a question is rare that someone has sent in my DM saying there is normally that tendency of saying that when a woman is too clean, or if they overbathe the central region or the vaginal canal, they predispose themselves to Candida. And in so doing, they say, this person is saying most of her Muslim friends actually are suffering from Candida and are relating it to washing that part so many times. Also, you talked about, I think you've explained the family planning thing because of estrogen. Can you throw just a little bit more light on pregnancy, and then that question about the Muslim girls that are too clean, that most of them are predisposing themselves to vaginal candidiasis?
Yes, thank you. The pregnancy is the same as the birth control pills, estrogen. Estrogen levels are higher in pregnant women. That is why they are predisposed to having more and recurrent infections of Candida. Then the one about the friends that do a lot of cleaning and are getting these infections, again, the balance. Like I mentioned in the beginning, that this area was naturally created by God to self-clean. The discharge that comes out of a woman is intended to bring out any microorganisms, any debris, any unwanted things. It comes out naturally. That is it, cleaning itself. But if you decide to go there and clean, usually women are encouraged to clean their external genitalia normally, not go inside. because the inside area is cleaning naturally. It is self-sustaining. So when you try to clean inside, you're disrupting the natural environment that is inside. And if you're disrupting it, then you're changing the conditions that are there that are supposed to maintain it in its normal, and then allowing many of these microorganisms to thrive. The products that are being brought there, introduced there also, changing the pH, again, you're changing the environment. So this environment is naturally supposed to be left untampered with, and it auto cleans. That's why people are naturally, women get that discharge coming out. It's supposed to be the means by which it is cleaning itself, not something external to clean it inside.
Okay, I'm now going to move to my friend Gerard, the nutritionist. And when we come back, Madam Flavia, you will throw more light on candidiasis, fungal infection and infertility, because we've also had so many female friends saying, oh, I cannot conceive because they said I had chronic episodes of candida, but also you're going to talk about candida and miscarriages. We've also, as a person that works in the imaging sector, I've also come across so many women that say, I've been losing pregnancies because doctors think I had chronic episodes of candida, and then we shall proceed. But before you come in again, Flavia, as we give you some time to take some coffee, as I'm doing to mine, Mr. Gerard, let's talk food. Let's talk about food. We are going. Let's talk about food. Okay. There is a lot of talk, especially online, about sugar and yeast infection, saying if you take too much sugar, you're going to suffer from candida. How strong is this link, and what is the actual science behind sugar and candida?
Okay, thank you very much for that question. And whoever gave you that question is actually very interested in understanding what is actually going on. So, as we've mentioned, candida is actually free living within the vagina. But sometimes you find that when someone contacts and gets that infection diagnosed, it feeds so much on ensuring that there's actually sugar. And it's even worse in highly refined sugars. The normal sugar we put in our teas, you find in pastries, simple carbohydrates, mandazi, cake, all these things have highly refined sugar that can easily feed infection. It's even worse when you're taking food that have what we call glycemic load. Glycemic load is how much sugar is packed into food. For example, Chile has more sugar than compared to a carrot. No matter how much we say educate of a carrot Chile has, that the sugar is so simple. When a woman consumes it who was already infected by candida, the infection is going to be fueled. That is the fuel it depends on. And you're taking diets that are rich in sweets, sodas, you find that these are things that promote the yeast growth. Then there's also misbelief that people that consume alcohol might think that alcohol is also not a sugar, but it's actually entirely sugar. And if someone is having that infection, you find that they're also fueling this yeast to grow as much as it can. It also weakens the immunity response and how the body can fight back on this yeast. Then people that have low fiber diets, and by low fiber diet, how much food is of raw roughages. Like you look at a chindazi and maybe a cabbage, it has more rough fiber than a chindazi, and a chindazi really low glucose.
Gerard, we are struggling with your connection. Can you get off and get on again?
Sure.
Yeah. Okay, friends. Again, thank you so much for being with us here. We are learning, and I'm learning personally a lot about candidiasis, and you see the angles or the parameters by which we are discussing. First, we go to the clinical setting. Now we are listening in from a nutritionist, and this is very good because now we are understanding Candida from different perspective, because Candida bwe bulwadde I think for so long bwe tuludde nga tuwaayiriza ebintu bingi, buli muntu afuna ekintu akiyita Candida, mukyala avaamu olubuto aluyita Candida, alemedde ofuna omwana agamba Candida. So having this discussion I think is clearing a lot of false information that has been circulating out there, and when Musawo Gerard comes back agenda kuba ayongera okutulaga emmere gye tulya etuyamba etya okuziyiza oba etuteeka etya mu bulabe bw'okuba ne Candida. But as we tulinda Musawo Gerard okudda, Mr. Nkusa, Mr.
Yes.
Nkusa, abakyala bano bwe bajja nga balina persistence candidiasis ono, mubayamba mutya okulaba, muyamba mutya ba clinician oba abajjanjaba abakyala bano okulaba nga mubabuulira, because abakyala basinga bajja nga balina resistance ku madagala gano ag'enjawulo. What do you exactly do okulaba nga muyamba abasawo okutegeera ki ekiyinza okuyamba omukyala ono okuwona ekiba kimuluma?
Yeah, usually ku malwaliro wabeerawo CMEs whereby people always enhance their knowledge according to the experiences. So abasawo tubeera all the time twesomesa technology, the new trends of treatment.
Okay, naye mwe mu laboratory what do you do? Muyamba mutya abakyala bano abalina abaludde nga balumwa okulaba nga mubayamba okutegeera nti gwe ekika kino kye kikuluma oba okubayamba okufuna obujjanjabi? Mubajjako musaayi, mukola cultures, what do you exactly do?
Of course, nga bwe nagambye tubajjako omusaayi ne tugukola culture oba ne tubajjako swab. Major tubajjako swab ku area erina obuzibu eyo webutera obulwadde we businze okukosa. Ne tugikola culture and sensitivity. Kati sensitivity report eyo usually ebeera very, very informative. Ne babeera nga bakozesa specific antibiotic as opposed to broad spectrum. Kakati ate trend empya eriwo nti abasawo babadde bakozesa nnyo broad spectrum antibiotics, kati nazo zitandise okubeera nga ziri resistant, zidevelopinze resistance. Kakati ate waliwo enkadde ezaali nga bazikaddiya nga tezikyakozesebwa, teziri so much consumed on the market. But some of them are resorting back to those old strong antibiotics, those strong antifungals, ezaali old, because zo kati ate zibadde ziri less used nga obulwadde bwa resistance yazeerabira. Zibadde zeerabirwa naye nga kati currently ate abamu kati ze baddako ne zibeera very effective. Naye nga n'ekyobuteekebeza n'ekyobutakola all the time nga obulwadde obukozesa that kind of antibiotic eri strong, finally bumala ne bugiresistinga. So majorly yeyo information ebeera awo ku fungal infections ezo.
Okay, so Gerard, we are happy to have you back. Obadde okyannyonnyola the relationship between sugar and yeast infections.
Yes, sebo. Mbere simanyi we nkomye naye omuntu alina Candida bw'aba ali nnyo sukaali ali processed gwe bakubisizaamu ennyo ogeza nga akawunga bw'oba olaba aka grade 1, 2, 3 ke bakubye ennyo akafaanana white ako kaba kabi nnyo era omuntu bw'aba ali ku medication n'agivaako n'atagimaliriza ate ng'akyali oyo sukaali omungi oyo ayise mu factory oyo omuntu aba agenda kufuna candida mpaka aba tagenda kuvaawo. N'oyo omuntu anywa omwenge ennyo ojja kusanga nga candida akulira okwo ku mwenge gwanywa kuba omwenge sukaali. N'oyo omuntu anywa ali emmere etalimu erirwafe eyo gye bayisizaamu nnyo akuuma ka factory ako nga bagikubye nnyo
eri highly processed.
Ennyini eyo gyasanga ng'omuntu alina candida agenda afueling agiwa bubi mafuta kukula.
Okay. Musawo ekitegeeza yo confirming oba oli tugamba nti ezimu ku cases za candida zetulaba nga abantu tebawona actually ngoba abantu babaddewo ebbanga ddene ng'oli tawona, oli osobola okuba nga wejjanjabya bulungi naye ng'ekiganya okuwonya simply because olya emmere erimu sukaali omungi. Kati akawuka bamusawo Flavia bakawa eddagala ate naawe okawa sukaali okukula kati muvuganya na ddagala. Okay, so ndowooza abatulaba mulabe lwaki tutandise okuleeta abasawo b'ebyokulya. Gwe sente zikugwako ogula ddagala naye ate bw'omala ogula ddagala noonywamu eccupa ya bbeere emu nga tonneebako oba eya bbiya. Mr. Gerald, this takes us to another question that was sent in by one of the clinicians. Yabuuziza nti no, can dietary changes prevent or manage recurring vaginal candidiasis, candida infection? If so, which food should we avoid or should we include in our diet?
Ono nga clinician ayagala okumanya kati nga bwe twogedde ekisooka sukaali oyo gwe bayisizza mu buuma bwa factory obwo nga mukubye nnyo mukendeezeeko oba muggirewo ddala. Osooka olye emmere eri balanced eri whole food bangeze emboga nga teteyise mu kuuma ki togikubye nnyo ng'ogenda kirya nga kiri nga Katonda bwe yakitonda. Ejja kuba ekuuma omubiri n'ekendeeza ku sukaali ayingira mu mubiri. N'ekirala zi processed carbs ezo keeki, kindaazi, buntuntu oba anything in wheat ekibeera processed kiba mafuta mangu nnyo okukuza ki candida. Kiba tekisingako n'olya ku bibala ebirina emibiri nga kati n'olya ku muyembe okuba guyambako, n'olya ku cabbage, n'olya emboga yonna bayira eba terina buzibu. Karoti, pepper nga byosingako ne ovacado eba esingako zino ziyamba okulwanisa candida oyo alimu oba ne biyamba bambuyite obuuka obulungi obuli mu mubiri. Bino ebibala n'emboga biyambako ne birwanisa ekyo ekiwuka ekibi kikandida ekiri mu mubiri. N'okulya ebibala ebirina vitamins ng'emicungwa, enniimu n'ebibala byonna ebirina yero biba biyambako okuzimba omubiri ne gulwanisa candida.
Okay. Musawo, waliwo ekintu, there is something new called probiotic supplements over fermented foods. How do probiotics and fermented foods support vaginal health?
Okay. Kati probiotics ziringa nga bw'ogamba kankimenye waliwo pro and biotic. Yes. Kati pro is after and biotic is life. So for them, the moment you consume the bw'okirya kibeera kiri already live. Kati bw'okirya kiyambako okuzimba obuko obulungi obutuli mu mbuto zaffe ne mu vagina. Kati omuntu bw'alya probiotics nga ebintu biba fermentinze ng'obusera oba yogurt biyambako okuzimba obuko obulungi.
Okomyawo balance eri musawo Flavia gyayogeddeko.
eyo yennyini eyo kati kati especially ye kati eno yo ebate bitandikira mu lubuto. Kati olubuto mu gut actually okuva mu kamwa paka wetuyisiza bweba health y'olubuto nnungi eba egenda kuyamba n'eri wansi mu central city gye tuyita vaginal cavity.
Ekigambo ekyo central city nkyagadde nnyo. Saga omuntu omugamba ava ku central city yange. So ndowooza awo we wava talk about yogurt. Bakyala bangi bendabye nga balina candida ne babagamba bakwate yogurt basiige eyo gy'oyise mu central city nga balina candida. In fact abamu ne babagana yogurt bamira madagala. What's your take on that?
Kale yogurt asinga kukola ng'omunywedde. Okumusiigako tekigenda yamba kuba kiri ekintu kiri kya system y'omubiri. Kiringa bwokera ne weesiiga ebizigo ng'olina pimple. Kiyinza okukola naye ate obuzibu tobugjeewo obuli munda mu mubiri. Kati yogurt ye bw'omulya oba n'onywanga obuseera kiba kisinga okumweteekako eyo wansi. Neera ate abasawo bangi sisuubira nti baba abasawo bakyogera kuba abasawo kyemmanyi abasawo abasomye tebakirekomendinga. Kiba safe n'okirya n'okozesa supplements eziri tested oba zi vaginal capsules. Naye ate byonna oba obirya buba kati kintu kya system. Si kyakulwanisa mpunya oba discharge eyo oba ina kukirya oba kibala n'okirya ne kiyamba ne kizimba omubiri.
Okay. Madam Flavia, over to you again. Nga twolekera last quarter yaffe nga tunatera okumaliriza before abatuuliza bw'oba oli eyo ng'olina any comment, any discussion, please don't feel shy, leave it in the comment section. Naye buli atadde wano ekibuuzo tugenda making sure nti tukiddamu. Flavia, twamaliriza nga nkubuuza nti you throw more light on candida and infertility, but also yogera ku candida and miscarriages or abortion. Abakyala bangi bagamba nti candida abaleetera infertility, kyokka abamu bagamba nti candida abajjamu embuto. What's your take on this? Yes, Flavia?
Yes, thank you very much. Kansooka okwogera ku candida ne infertility. Nti there is no direct correlation between the two. According to the different studies that have been made, there is no direct correlation between the two. Rather, there would be an indirect one, because tugambye nti omuntu omukyala bw'abeera ne candida ng'ali recurrent signs and symptoms ezimu ze twogeddeko nti abeera ne discomfort oba pain during intercourse. So this alone is going to change their attitude towards intercourse kuba buli lwabeera mu kikolwa ekyo abeera alumwa. Signs and symptoms ekyo kyokka kigenda kuba nga kimuggyako psychologically. Then n'ekirala kye twagambye nti if we are altering the balance that is in the central city nga bwe mwagambye, if we are altering the balance that is there, tuli mu kucyankalanya environment eriyo, it's going to be more acidic. The pH is going to be altered and it will be more acidic. Now, this environment, egenda kubanga eziyiza this sperm to move as it should be. It limits sperm motility to the uterus. So maybe that is when we can think of that environment or that condition bringing difficulties for someone to conceive. But I can't confirm that there is a direct correlation between the two from what I have read so far.
Okay, and Flavia, again, from a public health perspective, have we done enough to educate women on vaginal candida and proper treatment options, do you think?
I think work has been done in that area, really. Mr. Nkosa already mentioned about the health education that is being given in different places. I know health education is given to women, especially during antenatal care, because I've been able to serve in that area as well. Women are being given this health education. Women are being told on what not to do. Please don't douche. Please don't clean under there. Please don't do this. But unfortunately, the advertisements and the different products on the market are being pushed louder, I think, than us in the health sector are talking. Kirabika markets zitusinzizza eddoboozi kubanga obeerawo n'olaba nga bagamba waliwo kano kakola bulungi, kano kawunyisa bulungi, kano kalongoosaayo. Kaakati, there are very many things that are pushing and pulling from different angles, and women love to hear and they love their health. Women are very proactive about their health. Kye babagamba okozesa bajja kikozesa. Unfortunately, mwe mugendera n'ebikyamu ebikozeseddwa. Work is being done, yes, but I think our voice needs to be louder than the products on the market that are being sold or pushed out to be used.
Yeah, because kyoyogedde kituufu nti ennaku zino osanga abakyala waliwo ne gwe nalabye nga sipure nti eno sipure gifuuwayo wansi ne wawunya bulungi n'ogamba ani agenda okuwunyiriza wansi era ayagalayo ki, you know, kati habbo simanye ono gundi wa gundi ono gundi kano okanaaba bwoti. So bakyala abali eyo mwenna twagala bagamba nti ebyo ebintu bye muteeka wansi eyo bye bitta obuwuka abasawo badde basomesa nti mu mbeera eyo abulijjo omuntu olina kulwala kandida kubanga obuwuka obulungi n'obubi bulina balance. Obubi bulina kye bukola mu mubiri n'obulungi bulina kye bukola. Kati gwe buli byokola ebyo oluusi bye bijjawo balance eyo. Sabbuuni gwe munaaba omungi alimu jiiki nti mutukuza bye mutukuza bye tutamanyi oluusi ebigenda okutuleetera obuzibu obwo. Flavia, you said we've done enough mu health sector, but we've done enough to talk about these yeast infections. We'll talk about access to treatment of women getting quick and easy, affordable access to treatment of these yeast cells.
Yes, I think they are.
Okay.
I think women are getting the treatment actually.
Okay.
I think the treatment is there. Even in those recurrent cases, the people that you hear that come presenting with these things, akugamba musawo nkozesezza eddagala. Kakati obuzibu obujjira ng'akozesezza eddagala lingi nga waliwo predisposing factor etali dealt with. Obuzibu obumu nti in trying to fight off the recurrent infection, olumu ayinza okugezaako okusikirizibwa okuyonjaayo ennyo, ate ng'okuyonjaayo ennyo okwo kwe tugambye okukyankalanya balance, kwegamba nga buli lwayonjaayo ennyo ekifo akireka defenseless against the infection. So yes, to answer your question, I think the treatment has been provided. The treatment has been provided. Different products are being used. The local ones, the systemic ones. Yes, I think it has been availed.
Okay. Okay. As we are concluding, let us go through the comments of our viewers and the questions, and then try to respond to them. Jordan says, hello, and they thanks us for the show. And the first question actually came from Jordan, who was saying, does Candida have a Luganda name? Flavia, do we have a Luganda name for Candida?
Eryo sirimanyi nange nkuze mpulira Candida.
Gerard, do we have a Luganda or a Runyankole name for Candida for your sake?
Not to my knowledge. Sijakole imbawa mpezi, maybe if there's someone in the on chat on call, or can maybe as well to a message out too.
People in comment section, how do we call Candida in your own language?
Candida.
Flavia, this goes to you. Solomon says, Flavia, please talk about vaginal steaming in relationship to Candida. Steaming.
Vaginal steaming. Vaginal steaming yo sirina we mumanyi ku Candida.
Abachala be Kampala mwekoze ebintu.
Anzasire ekyo mbadde sinaba kikonfaminga.
So Solomon, ono gwobuuzizza tujjamu abo uniform.
Sinaba kumutegeera bulungi in relationship to Candida. Like I said, very many things are happening. Very many things are happening. So usually I like to stick to what has been studied and researched and confirmed to work.
Okay.
But yeah.
Okay, so another question from somewhere is saying, can Candida be treated or managed without non-medicine alternatives? Gerard?
It can be managed, but it cannot be treated. The only way we can treat it is through medicine. And all other approaches are there to ensure that we enhance on the strength of the treatment. Omira eddagala lyo nga bali kugambye nti 2 times this biki ali n'ogenda n'onywa kibiya n'oteekamu ebindaazi ebikomando, ebyo byonna biba byongera muliro eri Candida okukula. Naye ate bw'omira eddagala lyo n'olya emmere etegeerekeka gye turecommendinga ffe ng'abasawo b'ebyendiisa, oba osobola okumumanaginga.
Okay. Flavia, this again for you. Someone is saying, secondly, you say that Candida cannot be transmitted. I think you corrected that. You said it can be transmitted, but not always. And then the other question is saying, talk about oral candidiasis. Where does it come from in men?
Mpozi kye nabadde soogedde mu ntandikwa akageri ke twabadde tufocusinze on vaginal candidiasis is that Candida is not only normal flora in the vagina. Candida is normal flora in the mouth. It is normal flora in the throat.
Bw'ogamba ekigambo normal flora otegeeza ki? Kuba eriyo abawala bayita flora.
Normal flora mbeera ntegeeza nti waliwo obuwuka. Obuwuka twakula tumanyi nti bwonna buleeta obulwadde. Small microorganisms cause infections, yes. But sometimes those small microorganisms are normally living on the body or in the body somewhere in some parts without causing infection. Nti waliwo organisms ezimu nga zirina okubeera mu lubuto naye nga bw'onoozijja mu lubuto n'oziteeka wansi mu central area zijja causingayo infection, naye ate nga mu lubuto zirina okubeerayo nga gye ziri normally. Kakati ekyo kye mbeera ntegeeza nti obuwuka buno bulina ebitundu ebimu bye bubeeramu nga bulina okubeerawo naye nga tebucausingawo infection, just the balancing the normal environment in that part of the body. Kakati apart from that central area, these Candida organisms, they are normal flora in the mouth, there are normal flora in the throat, in the gut, and in the vagina. Nga bwe twagambye. Nti in case of any changes of the risk factors ziri ze twagambye, it's not only the vaginal candidiasis that can happen. Someone can also get the oral one. They end up showing with an oral thrush. Someone can end up showing with a skin infection. Someone can end up showing with a gut infection or with an invasive kind of candida. So someone can get that oral thrush if they are predisposed nti ajja funa oral candidiasis kubanga abadde alina okubeerayo normally naye waliwo ebireese enkyukakyuka mu environment eyo.
Flavia, is Candida more prominent in some communities, certain communities, than others?
Not that I'm aware of yet.
Okay, and then lastly, how can public health policy help in reduce the risks of Candida infections or outbreak, especially in hospitals and nursing homes?
Hospitals and nursing homes. Waliwo ebika bya Candida ebirala bye twabadde twayogeddeko waneeno kuba twabadde tusinze kwogera ku
vaginal Candida. Yes.
Naye waliwo Candida, there is candidiasis in other parts of the body as well. And there are also other organisms that cause candidiasis apart from the albicans that we commonly know. Kakati mulimu ebintu ebimu nga byo bisinga causinga candidiasis in the hospital setting. Yogedde ku hospitals and nursing homes. Some of these kinds of species are a bit more resistant. There's a species that we call Candida auris. Yeah, I think it is the auris, yes. And it is most commonly in these hospital healthcare acquired infections, the nursing homes and the hospitals that you mentioned. And unfortunately, this particular species is a bit more resistant. And this particular one can be transmitted from one person to another. Nti omusawo asobola okukola ku muntu ng'abadde nayo bw'agenda okukwata ku muntu omulala ng'abadde tagiina asobola ogimusiiga. Nti akawuka ako kasobola okusigala ku surface oba nga ku mmeeza y'omusawo ne kamalako omwezi nga mulamba nga buli ajja akatoolako n'akasaasaanya. Nti kasobola okubeera nga katambuzibwa okuva ku muntu omu paka ku mulala ne kakula. Kaakati mu bintu bwe bityo, we want to strengthen the infection prevention measures in the facility setting. Nti omusawo bw'aba alina omuntu gw'akozeeko alina okunaaba engalo. Nti bw'aba akozesezza thermometer ku muntu omu alina okumakinga sure nti agidisinfectinga nga tannagiteeka ku mulwadde mulala aleme musiiga that particular kind of candida infection. Kakati tubeera twagala okustrengthening health infection prevention and control policies in the facility until the standards are actually upheld. Then on a general, we also want to look at the products that are being allowed to be marketed because they are some of what is contributing to the candida problem. So we want to look at that as well, that there is some level of control to what is on the market. Because women are using it and they are falling prone and they are in and out of hospitals and all the negative associated stigma that comes with having candida. As you mentioned, many people don't want to come forth because they think if I go and say I have candida, bajagamba ndi muchafu oba bajagamba I am sexually promiscuous. Actually, it could be none of the above. Muntu asobola okuba nga innocently yagula akantu ke awunye bulungi akantu ne kamuleetera obuzibu.
Then then this question from one of my besties. Say, thanks, doctor. Kindly inquiring if there are some candida signs that show up in the V of a central city towards the menstruation period.
It is not common. If you're having signs and symptoms of candida, please seek medical attention as soon as you can. If you're showing up signs.
Okay. Gerard, what you as a nutritionist, what's the biggest misconception you wish the public would stop believing about candida as we conclude?
Well, the fact that one of the you asked me, the first one I start with is ensuring that they stop using yogurt for applying, but then also knowing that sugar, as you consume the food, it doesn't necessarily mean that the sugar you're taking is also going to help in building your body to ensure that you stay strong to fight the infection. No, that is a misconception. You should know that an increase in sugar intake when you have candida increases the stay of candida in the body.
Flavia, in a minute, if someone suspects they have a candida problem, what's the first thing they should do immediately?
Medical attention. Medical attention. Effective, timely, ate nga dosage mazeeyo. Mpozi n'ekirala mbadde nsaba ompemu eddakiika just to address there's someone that talked about candida and abortion. Twabadde tetumuseemu. Yes, it's actually very true. It is one of the complications nti omukyala ow'olubuto bw'aba nga alina candida tubeera tumukubiriza making sure nti afuna eddagala nga bukyali kubanga infection eno bw'etabeera treated asobola okuvaamu olubuto lwe. There could be an ascending infection from the vagina and it goes up. So ayinza okuvaamu olubuto lwe, ayinza okuzaala omwana we nga tannaba kutuusa nti membranes zino ezikuuma omwana zisobola waliwo membranes ezirupturinga when someone is in labor nti zisobola okurupturinga before the right time. Kaakati ebintu byonna bino bisobola okubaawo. So yes, there is a high risk of all those things in relation to candida infection.
And then I said if someone is suspecting candida, what one thing should they do first?
Sorry, pardon?
If someone suspects they have a candida problem, what's the very first thing they should do first?
Agende mu ddwaliro. Musawo Nkusa yabadde atunnyonnyodde nti bakola culture and sensitivity. Omuntu bw'aba alina candida problem bw'aba agenze mu specialized facility basobola omukolako culture and sensitivity. Bw'aba agenze mu lower healthcare facility still basobola omuwa eddagala obujjanjabi okusinziira ku signs and symptoms apresentinze with.
Gerard.
Yes, please.
In one sentence, how can someone, Mr. Flavia has been talking about the reason people get candida is basically due to imbalances of these useful and useless bacteria. As a nutritionist, what is your number one tip to every woman listening in right now on in making sure they have a balance of these?
In one sentence, have a balanced diet.
Okay.
Yes.
Okay. Then Flavia, if there is a woman listening in to you from Katente, where I come from, the village that I love so much, what's that very first step they should take to prevent themselves from getting diseased cells if they have not yet contracted them?
Nsinga okwagala okukubiriza abakyala nti ebintu by'okulongoosa munda si kungulu ngamba munda ebyokusonsekayo n'olongoosa bambi ebyo tubiveeko. Ekitundu kino Mukama yakikola nga kyerongoosa kyokka. Ebyokuwagala ffe tuyingire munda tugezeeko okweyamba. ebyo tubiveeko. Ebyokozesa sabbuuni ow'obuwoowo nga tunaabayo wansi, sabbuuni ow'obuwoowo oyo naye tumuveeko, n'ebirala byonna byonna eby'obuwoowo. Waliwo gwe nalabye abuuza nti ebyokuwunya obulungi tubiveeko, ebintu by'obuwoowo wansi eyo.
Era nange message nagireseewo awo paka ng'ogirabye kuba nannyini message eyo yaŋŋamba yajava ku channel eno ebibuuzo bye nga tetubiddamu. Yenna yabuuza ekibuuzo ky'obuwoowo tubuveeko.
Ebintu bya scented soaps, scented things wansi, bambi ebyo byesonyiwe. Mukyala ebyo biveeko munda tolongoosaayo, wagenda kwerongoosa wokka. Otherwise oyinza okwagala okulongoosaayo n'oyonoona.
Friends, again, I really want to thank you for taking off this time to be here with us. I believe we've uncovered a lot of truth. Generally, personally, I think now I'm more knowledgeable about vaginal candida, and I believe I'm going to be more helpful to the people right now. Njagala okubeebaza mwenna abakyali naffe paka obudde buno, mwebale nnyo, mwebale eddala. Again, like I always said, the reason I wake up and host these people every Sunday morning is because of that one viewer I'm sure of will be watching this show. People that have been on this channel ever since we started in March, if you go back to check the videos, the video that has had 1 to 5 people watching, but those 1 to 5 people kept motivating us and the different panelists to keep coming here every Sunday to make sure we inform. And again, I want to thank all the panelists that are coming through every Sunday to teach the public. We believe this channel is going to increase public health awareness. We are going to pour out a lot of healthcare information. And in the end, we are going to help people make a very good informed decisions about health. I and the panelists here believe that the more we learn about diseases, the better we are going to become. We believe that actually we can make the world a more safer place for everyone. But again, everyone has a role to play. Our role is to come here every Sunday and pass out this information. Your role is to listen and apply. This channel up today is still free. Very free. So be generous enough and pass this information to all the females that are in your inbox. We share so many memes, we share so many songs, we share so many things. Please, today be generous enough and share this video to any female in your life. Why? Because so many women are suffering from yeast infections of vaginal candida, but they cannot come out to speak because of what Mr. Flavia said. Nti abakyala bangi balowooza vaginal candida bajja mugamba nti mukyafu. Naye kimu kye twagala okukiriyalinga nga tetunnava ku mpewo olunaku olwaleero kiri nti vaginal candida taleetebwa bukyafu bwokka. There are so many reasons ng'abasawo basomesezza omukyala kw'osobola ofunira vaginal candida. Ng'ezisinga obungi era ekibaddeko essira kisinziira ku bintu biri munda, imbalances z'ofunye mu mubiri gwo. Nga tukosa ebintu bye tunaaba wansi eyo, musawo Gerald asomesa ku byokulya nti buli oli ebintu ebirimu sukaali, obuuka buno obwa yeast, kubanga musawo Flavia agambye nti batuzaala nabo tubulina mu kamwa ne mu bitundu ebirala. Naye ekyenjawulo ekirinamu abo abatali balwadde nti bo balina balansi y'obuuka obubi n'obulungi. Kati gwe bw'onookola ekintu kyonna ekijjawo balansi eyo, ekijjawo obuuka obulungi, for example omize antibiotic eziri broad spectrum ne zitta obuuka bwonna obulungi, ogenda sigala n'obuuka obubi nga bungi. Bwe bunaabeera mu kamwa, ogenda tandika okufuna oral candida. Bwe bunaabeera wansi mu central city, ogenda tandika okufuna vaginal candida. Ekitegeeza nti olunaku lwali tuyize ebintu bingi, misconception ezibaddewo nti si buli mukyala nti alina candida. Abasajja bangi abali eyo buli wafuna candida n'agamba omukyala. Kino kinjukiza nti waliwo omwami omufumbo gwe baagana okwegatta ne mukyala we kumpi emyezi 6 olwa candida. Nga bagamba omwami awo omukyala candida and things like that. Yes, musawo agambye nti wayinza okubeerawo transmission, but there are so many other causes eziyinza okuba ensonga lwaki abantu bafuna candida. Nkwebaza okuba omuwuliriza omulungi. Chairman waffe w'abantu wa wansi Kyamagero Andrew agamba nti tuba mu kweyubula. nzikiriza nti buli lwa Sunday tujja wano okweyubula. Buli we tunaawulira information abasawo abajja wano ne batagenda mu kyaki batusomesa ne tukola okusalawo okutuufu ku bintu ebyenjawulo. Tugenda kendeeza omuwendo gw'ensimbi gwe tusaasaanya mu malwaliro buli lunaku. Njagala okuwa statistics nti ffenna we tukulira half y'ensimbi ze tukola mu bulamu tuba tuzispeninze ku bulwadde bwaffe oba ku bya bulamu. Kitegeeza nti bwe tuwaayo amaanyi ne tukendeeza ne tureducing emirundi gye tulwala tugenda kuba tumuvinga towards okubeera abagagga oba okubeera n'obulamu obulungi. Bino yinza okubiraba nga si bya mugaso. Naye omusawo agambye nti buli wooli ekintu ekirimu sukaali, bia, emmere eri highly processed. Emmere eri highly processed lwaki batugamba nti ebamu sukaali mungi? Kuba oli ajja kugamba nti njawulo ki eri bwe nnywa juice w'ekikajjo n'okulya ekikajjo. Buli wooli emmere eri highly processed. Obusawo obutereka glucose ekyuma ekikuba kiba kyabumenyeemenye nga sukaali alirwedde aveire baayiika buyiisi. Kiringa onokwata akambe n'osala mu honeycomb oba ekintu ekirimu omubisi gw'enjuki guba guyiika. Kyokka bw'ogirya ng'eri mu foomu etali processed, emmere emu ogirya ng'eri mu busawo bwayo, kati bw'etuuka mu mubiri eyiikamu mpola mpola. Naye n'eri processed bw'oteeka mu mubiri mu kamwa etandika okubeera absorption etandikira mu kamwa kubanga sukaali already mu ready form to be absorbed. Ensonga lwaki oyinza osanga ng'omuntu alina sukaali bamugamba tonywa juice wa miyembe naye ate bamugamba ali omuyembe, nti omuyembe obusawo obutereka sukaali oba bukyali wamu. Kyokka ate w'okola juice wa sukaali obanga anywa sukaali yennyini. So ku channel tuyigako ebintu bingi. Abamu tulina abantu mu byalo eyo gye tuva nga buli ssaawa baweereza ssente z'obujjanjabi n'omwana gwe waleka eyo buli ssaawa alwala. Abasawo bano eb'ebyokulya okutandika okubakyaza. Sinnawulirayo omusawo ajja n'atugamba sukaali mulungi. Bannange lwaki tulemedde ku sukaali? Buli musawo gwe netawana kibasooka okugambawo ebyokulya gaba naye muve ku sukaali. Why are we still persistent on taking? Noonya sukaali n'okomba nako n'ogamba ine mberenge. Ekyawandiikibwa kigamba mu I think kiri mu Hosea nti abantu bange my people perish because of ignorance. Katonda aga nti abantu bange bafa oba babonaabona oba baggwawo olw'obutamanya. Every Sunday we come here to fight ignorance. Tuyinza okuba tetulina political parties, tuyinza okuba tetuli mu kibiina kyolimu, but this is our contribution to our country Uganda. We want to create a healthy environment. We want to create a sustainable, because a healthy nation is going to grow, but a sick nation tetusobola kulanga abantu bafa ku myaka 35. We can't. We can't grow if you spend half of a month in hospital. That's why every Sunday we come here to talk about these things. It is costly in terms of time. It is costly in terms of sleep. It is costly in terms of data. These people load data for 2 hours to be here. So munnaffe gwali eyo tukusaba nti toba wakisa video eno gisharingira abantu mu groups zammwe. Temuli biwemula, temuli ki, to make sure it can be shareable, nti musobola n'okugiraba nga muli ewaka. To the parents, your teenagers are in the house. Find time to watch these videos with them to enlighten them. Abaana ba campus Candida ali yakuba ne baaka sama. Mulya kikomando, lw'okyusiza n'olya chips, lwe bakututeko out n'onywa bia, n'onywa soda kimuyita okuba obulungi. Olumala ntufuna Candida. Today expecting mothers, musawo asomesa nti Candida asobola okugyamu olubuto. Kitegeeza mu preparations zetukola nga tunnafumbirigana oba nga tunnafuna lubuto, management and prevention of Candida or yeast infection should be one of them. And lastly, gwe muntu yenna alina Candida nga akulemeddeko, omusawo nkusa yasomesezza n'agamba nti basobola okukola culture ne bakuulya lwaki Candidawo akyagaanye. Musawo Flavia, before you leave, can you giving us your closing remarks to all the women listening in today? As a fellow woman, a public health specialist, I want you to give closing remarks on the topic and then send regards to your family, then later Gerard will do that, will do the same.
Yes, thank you very much. First of all, I'd like to thank our viewers today for listening to me, to us this Sunday morning. And what I'd like to encourage all the women that are watching us this morning or will watch us later is that this our reproductive area, the vagina in particular, it was created by God to naturally clean. So let us not make attempts in trying to help in that very particular function in that area. Kyenjagala okukubiriza nti banne bwe tuba twerongoosa, weerongoose paka wabweru w'olaba, toyingira munda gy'otalaba. Nti bw'onoogezaako okuyonja ojja kwonoona, bw'onoogezaako okuyonja abasirikale bonna bonna abakuuma ekifo ekyo nabo ojja baggyayo, okireke nga tekikuumiddwa, nga kiri susceptible to infection. Kyekyo lwaki abantu bali mu kufuna infections eziri recurring. Ekifo kino tukireke kyeyonje kyokka kyokka with that discharge that comes out. That is what is supposed to be cleaning it, the system naturally. Saagala kweddingana kuba kino kyekintu kyekimu kyembadde ndi mu kwogera all throughout this show. Balance eno tugireke nga bweri. Njagala okwebaza okumpuliriza omulundi omulala. Ntumira mikwano gyange naye okusingira ddala abalabi bonna bonna abasobodde okuwaayo obudde bwabwe ne batulaba amakya ga leero. Mukama bawe omukisa.
Thank you so much. Gerard, from your perspective as a nutritionist, what are your closing remarks on the topic? And please send your regards. And again, thank you so much for being here. I really liked the vibe, both what we had before the show and after. Please, next time, do the same when we invite you. And again, to our viewers, we are going to be having Gerard join Christopher and Malka. I gave them Wednesday, every Wednesday they will be teaching us about nutrition. So expect an episode from one of the three every Wednesday talking about how to eat, because I'm telling you, this is the only way we are going to promote health and fight diseases 2025 and beyond using the readily available foods that we have. Yes, Gerard.
Thank you so much, Mr. Selfcare. And to our viewers and listeners, thank you so much for tuning in. At what time you've caught us, this is still information still relevant to you. I want you to remember that vaginal candida is not just a medical condition. It is influenced by a number of things we do every day, especially the things we eat, the food we eat. The diets we eat are usually high in sugar and very refined carbohydrates. And this creates a very good environment for the yeast to grow. Try to change your diet to ensure that your foods are naturally made they're naturally made and not factory based. This reduces the fact that you're eating processed foods. Nekirala, emmere gye tuyise probiotic eyo n'emmere ebiseemu nebanga egenda okukola omwenge eba eyambako, si mwenge gwennyini naye nga erina engeri gyetuuseeko ng'obusera oba yogati, eyambako okukomyawo obuwuka obulungi, kale akawuka akabi ne kakendeera. Ekirala ekisembayo, emmere byensomesezzaako ebyendiisa tebigenda kugyawo ddagala ly'ogenda kukozesa, naye ate byonna bijja lumu ne bituyambako okukakasa nti kano akawuka ka Candida akabi akakuze ennyo tukagyawo. Beebaza mwenna, thank you for joining us today and I hope you feel empowered. Bino byetukusomesezza bangi bana twogedde, tusuubira nti bino bijja bayambako okubeera obulungi. Mbatumira mwenna mikwano gyange famire, mwembasabira samyereere. Thank you so much, Mr. Selfcare.
what a powerful and informative discussion we've had today on this channel, and on understanding vaginal candida. A huge thank you to all the brilliant panelists, Madam Flavia, Mr. Nkusa, and Mr. Gerard, for sharing your knowledge and clearing up the confusion and mix-up around this very common and yet misunderstood condition, vaginal candida. And again, thank you to you, our amazing audience. Every Sunday we come here excited and anxious because we know there is someone that is going to tune in and watch. It gives me motivation, courage to continue pushing on this program until the last person is turning. And we promise to do the same every Sunday and Wednesday when we host different experts. Again, thank you for asking these important questions in the comment section. These questions sometimes help us to moderate and to exhaust things that need more explanations. And so you keep us motivated, you keep us engaged and entertained while we are in the studios of Mr. Selfcare Live. And to all the sponsors, thank you so much for being part of this needed conversation. And again, if you have a product that you need to show out to the public, please write to us, come to our inbox. We shall be able to engage and have your product reach out to the masses every single day. If you found today's discussion helpful, please remember to like, to subscribe, and to comment on this video. But again, share this information with someone, because that's the only way we can cause the change or a healthy society that we want to create around. Your health is in your power. And every Sunday at 7 a.m., we are here to support you towards better self-care and towards better healthcare decisions. My name is Mr. Selfcare from the studios of Mr. Selfcare Live. And until next time, stay informed, stay safe, take care of yourself. May God bless you. I will again leave you with a verse that comes from Isaiah that says, "My people perish because of ignorance." I hope you are not ignorant again about candidiasis. God bless you and have yourself a blessed Sunday. Bye.